Good evening, everyone, and welcome. Thank you for joining us today for this webinar hosted by Mindful Moments, a mental health society here in Tbilisi, Georgia. It's nice to see all of you here today who took the time to be here. My name is Marzouk Ahmed. I'll be one of your moderators for today's session. Our focus today is seasonal affective disorder, often referred to as SAD. What it is, we're going to go over what it is, how it affects people, and most importantly, how we can recognize it and respond with practical, healthy strategies. Now, I'm not the expert here, but we do have today with us two doctors who will definitely go over the psychological approaches, the symptoms, and so on with SAD. This session is meant to be informative, supportive, and interactive. You'll never be expected to share anything personal, but we do encourage you to participate in the activities if you feel comfortable. So just a quick note before we begin, please keep your microphone muted unless you're invited to speak. You're free to use the chat or click the raise hand button if you wish to speak. We also want to inform you that we will be having a Q&A session near the end of today's webinar, so feel free to participate by whatever means works for you. But before we get started, Nisreen Liaquat is our founder of Mindful Moments. She has a few words that she'd like to say, so I pass it on to you now, Nisreen.
Hello guys, hello everyone. Thank you so much for joining this webinar, and I give you a warm welcome, and I'm so glad that all of you have taken the time to be in this webinar and everything. And seasonal depression can quietly affect so many of us, especially during the colder months. And today, I think it's all about understanding it better and reminding ourselves that we always have the support and hope that we have always available. I would like to express my sincere gratitude to the president of Mindful Moments and the team of Mindful Moments, including the operations director, the social, the events, and the partnership and outreach director. And also, I would like to reach out my sincere gratitude towards Dr. Mariam Abisonashvili, who is a family medicine doctor in Raymond Clinic, and also Mariam Shirdileli, who is a renowned psychologist. So thank you so much for joining in, and I hope you all have a very insightful time in this webinar. So I hope you guys enjoy as well. Marzouk, over to you. You can continue, please.
Right. So I'm passing it on to Ahmed, who will get you started. So yeah, Ahmed, go ahead.
All right, thank you. So hi everyone, I'm Ahmed Sameh, and I will be your interaction coordinator for today. Think of me as your friendly guide between our amazing speakers and activities. My role is to make sure you all feel comfortable, engaged, and connected throughout this event. This is your safe space. No judgment, no pressure, just a supportive community coming together to learn and grow. Throughout today, I'll be popping in with some fun, quick activities to keep our energy up and help us all connect. Everything I do is totally optional. You can participate as much or as little as feels right for you. Before we dive in, I want you to know whatever you're feeling today is valid. Winter can be tough for so many of us, and you're not alone in this. We are all here to support each other. So let's start with a gentle check-in in the chat. I would love for you to share a weather emoji that matches how you're feeling today. Are you feeling sunny, cloudy, a bit stormy, maybe snowy? So drop in the chat, no explanation needed, just the emoji. Take a moment to look at all the different weather patterns in our group. So here you go, guys. I shared the poll. I'd love for you to participate in it. All right. Thank you all for sharing so openly. I can see we have a beautiful mix of weathers in our group today, and that's perfectly okay. So, thank you for sharing, and pass it on to Marzu.
All right, then. So now let's get started with the main event. So our first speaker here today is Dr. Mariam Abisonishvili, family doctor, who will be speaking about the impact of seasonal depression on both patients and healthcare professionals. As you listen, feel free to note down any thoughts or questions that come up, especially for the Q&A if you want to participate in that. So Dr. Mariam, I'll hand it over to you now.
Good evening, everyone. I'm glad to see you. And first of all, I would like to thank the Mindful Moments team for this event, for creating a space where we can openly talk about mental health. And I would also like to thank everyone who is here today, who is willing to listen, learn something new, and improve self-care, and then, of course, improve care for their patients in future. I want to share, I prepared a small presentation for you for today, and please tell me if you can see it right now.
Yes, we can see it.
You can see it, right? Yeah.
Mhm.
Okay, in the beginning, I just want to tell you that the seasonal depression is not something new. First, it was noticed more than 2,000 years ago by Hippocrates, who wrote that melancholia, depression was called then melancholia, was worsening in winter when days were shorter and light was much less. But the term seasonal affective disorder said only appeared lately in 1984, when a psychiatrist, Norman Rosenthal, released that his own depression came every winter and disappeared in every spring. So he made some experiment with bright light, and his symptoms started improving. So seasonal affective disorder entered modern medicine not through just a theory, but through lived clinical experience. And even today, it remains one of the most predictable, but yet under-recognized mood disorders, unfortunately. So what about seasonal depression itself? When we talk about seasonal depression, we usually think about patients, right? But winter does not stop at the patient's door only. It affects how our patients feel and function mentally, physically. It influences also how we think, decide, and respond clinically, right? Well, us as doctors. And it also affects us, our energy, our emotional resilience, and our capacity for empathy. In winter, the consultation room itself changes for both sides of the desks, not only for the patients. Seasonal depression is not just a patient problem, it quietly affects our patients' mental and physical health, like mood changes, motivation changes, adherence, may exacerbate sometimes chronic disease control, bad chronic disease controls. Our clinical decision-making may be changed, like attention, empathy, diagnostic curiosity, therapeutic patience, our own emotional resilience as a clinicians also changes energy, we have low energy, low tolerance, compassion, and we have, unfortunately, the higher burnout risks, especially in winter. So still, what do we mean by seasonal affective disorder, what we call? When we talk about seasonal depression, we are not referring a simple winter tiredness. It's just recurrent depressive disorder with a predictable pattern. And most often starting in late autumn, like in October or November, when the day starts being much shorter, or even in December, so in winter. And it's formally recognized diagnosis in DSM. Reduced daylight plays a central role disrupting circadian rhythm and affecting serotonin and melatonin regulation. Vitamin D deficiency is often present, but it's important to remember that this is an association between vitamin D deficiency and mood changes rather than a proven causal factor, okay? In other words, seasonal depression is a biologically grounded, clinically relevant condition, but not a lifestyle issue. I will say several words about statistics because it is not rare as it may seem, especially in primary care where I work. Oh, by the way, I forgot to introduce myself. I'm a family doctor. I work in Raymond. Probably most of you knows me already from your family medicine clerkships. And I want to say that lifetime prevalence in general population is estimated up to 3%, and it's much higher in primary care in family doctors' offices. And most cases may be up to 10% of patients. Among people who has already diagnosed with depression, about 15% show a clear seasonal patterns. And symptoms usually begin in early adulthood between 20 and 30 years of age. And ladies, we are having much higher risk for seasonal affective disorder. And also, it may reflect differences in help seeking rather than a true prevalence. Because actually men and boys don't like to talk about their emotional issues. And that's why right now it's recommended as a prevention to make once in a year PHQ-2 and GAD-2 short questionnaires, just to ask the patient if their mood has changed during the last 2 weeks. And I want to say and also that daylight exposure appears to be more important rather than geography just itself. About symptoms, I will say several words because I think Dr. Mariam will talk about this more interesting things. But still, there are symptoms we see every winter and often normalize too quickly. Low mood and apathy, we expect hypersomnia. Sometimes patients say that carbohydrate cravings, and we make some jokes about that, right? They say that they have reduced concentration and they blame themselves that they are not productive anymore. As clinicians, we frequently label these changes as burnout, seasonal tiredness, or worsening of chronic diseases. In young adults, we try always to find some somatic diseases or maybe some deficiency of micronutrients like iron deficiency, vitamin B deficiency, or sometimes vitamin D deficiency also. Especially such kind of symptoms you may see in patients with diabetes, with cardiovascular diseases, or in patients who have chronic pain. 1 week ago, ADA, American Diabetes Association, released their new annual guide where one of the most important risk factors of diabetes was insomnia and sleep disturbance. So the problem is that when we see all these symptoms, we may diagnose depression while making some screening tests, but we may miss the seasonal pattern and therefore miss the opportunity for targeted and effective treatment for the disease. What about outcomes? Seasonal depression rarely presents as a patient saying that I feel depressed because it's winter. Instead, it shows up through outcomes, right? We see poor medication adherence, mostly in patients who have chronic diseases, more somatic complaints, and a clear worsening of chronic conditions such as diabetes, cardiovascular diseases, and again, chronic pain. Patients come more often, need more reinsurance, more investigations, because they say that they don't feel much well, and yet engage less in lifestyle changes that we know are essential for long-term outcomes. In primary care, in family doctor's office, seasonal affective disorder often presents indirectly through behavior, through symptoms, and also without ever naming itself as depression. One of the reasons seasonal depression is so often missed is that it changes behavior before it changes mood. Patients may become less adherent, less active, more withdrawn, or less engaged in self-care while still denying feeling depressed. By the time low mood is clearly expressed and behavioral consequences have already affected clinical outcomes, unfortunately. Yeah, mostly symptoms, very popular symptoms that I think you already know is just hypersomnia. Patients like to sleep whole day. They say that even if they sleep at least 10 hours per night, it is not enough. As I told you, carbohydrate cravings and the social problems because they try somehow to isolate and they have some problems in their relationships also. Now, it was okay to talk about patients, right? Now let's talk about healthcare professionals. Because healthcare professionals, we have high risk of developing seasonal affective disorder. Not because we are weak or any other thing, but because of how and where we work and how much. Long hours spent indoors in the clinic under artificial lights, combined with reduced daylight exposure in winter, disrupt circadian rhythms. At the same time, we carry a high emotional load, absorbing distress, responsibility, and uncertainty every day because we never know what to expect today when we come to the clinic, right? And also, we are trying to be very empathic towards the patient, and when the patient is feeling some depressed or has changed mood and wants to share some like bad experience or talk about their mood changes, it's very hard for us, right? What is often produces is not overt sadness, but emotional numbness, irritability, reduced empathy, and decision fatigue. Unfortunately, these are all sequelae of our SAD. Many clinicians describe this is not as burnout, but as sometimes quieter cynicism, you may see, emotional distancing, or loss of meaning. This quiet burnout is often seasonal and often overlooked. When doctors say they are tired in winter, we usually interpret this as physical fatigue. Long shifts, poor sleep, lack of daylight. So we say everything but seasonal affective disorder, okay? But very often what hides behind the winter fatigue is emotional exhaustion. It's gradual depletion that comes from continuous responsibility, repeated exposure to suffering, and limited time for emotional recovery. Because it doesn't always look dramatic, it's easy to miss and also easy to normalize. Why it matters clinically? This matters because our mental state directly shapes how we practice medicine. I'm a member of European Academy of Teacher Family Doctors, and there is the first rule in this organization is that if you want to be a good teacher and family doctor, first of all, well-being of the doctor is on the first place. So in the beginning, I was very confused. What does it mean? But right now, while practicing the medicine, right now, I understand more and more. When clinicians are affected by seasonal depression or emotional exhaustion, consultations often, unfortunately, become shorter and less empathic, not by intention, but by limited emotional and cognitive capacity. Diagnostic curiosity decreases. We ask fewer open questions, explore fewer possibilities, and may either over-medicalize symptoms or fail to recognize underlying mood disorders. Cognitive fatigue also increases the risk of errors, medical errors, mistakes. Not dramatic mistakes, but enough to affect patients' safety and quality of life and quality of care. And mental health of healthcare providers is not a personal issue. It's a core determinant of care quality, I would say so. What about patient-doctor interaction? What happens in winter consultations is often, decided process. Patients with seasonal depression tend to need more emotional care. They come more often, present more somatic complaints, and require more reassurance. At the same time, doctors may be emotionally depleted themselves. Our capacity to contain distress, tolerate uncertainty, and stay empathic is reduced. This creates a feedback loop. Dissatisfied patients, too many complaints about doctors, frustrated clinicians, and consultations that feel heavier and less effective. And it's important to say this clearly, this is not professional failure. This is just simple neurobiology. Emotional regulation, attention, and empathy are all affected by fatigue, circadian disruption, and prolonged emotional load. What can we do for our patients? Just psychoeducation, first of all, saying and explaining their condition and disease, normalize seasonality, like saying or trying somehow to reduce the symptoms. Screen for depression. We use PHQ-9 questionnaire in primary care because psychiatrists have their own Beck's questionnaire, and of course encourage the patients. In winter, every 12 depressed patients, at least 2 of them may have seasonal affective disorder, which is under-recognized. I just want to show you a little bit different slide. Nisrine knows Erich Fromm is one of my favorite psychologists and writer. The Art of Loving, Erich Fromm reminds us that love is not passive. It's an active capacity that requires our energy, our presence in the relationships and engagement. But winter, I want to connect this to seasonal affective disorders, okay? Winter challenges all this. Energy drops, engagement decreases, and as a result, connection begins to suffer. Relationships maybe have some troubles. This reframes how we see seasonal depression. Patients don't stop caring about others. They lose the emotional energy requiring to stay connected and to stay in the relationship, included in the relationship. Social withdrawal, therefore, is not rejection. It's not a personal change. It's emotional depletion, okay? Clinically, this matters because treating seasonal depression does not just improve mood scores. Remember, guys, it helps patients reconnect with people, improves their relationships, improving their life. Of course, this situation has treatment. I won't bother you with too much information. Just remember, first-line treatment, bright light therapy. This is the first-line evidence-based therapy. Second line is antidepressants. SSRIs have more priority, of course, like sertraline or fluoxetine, and of course CBT, specially adapted for seasonal affective disorder, cognitive behavioral therapy. Bright light therapy is considered as a first-line therapy, and the recommendation is the 10,000 lux of bright light administered in the morning, usually shortly after walking. Clinically, we can expect response or remission in around 60% of patients. This is too much, often within just 1 to 4 weeks. Which is relatively fast compared to many pharmacological treatments. Light therapy is especially helpful for patients with hypersomnia and increased appetite, particularly carbohydrate cravings, symptoms that are very typical of winter pattern depression. I want to say one more important thing, that there is, during psychiatric disorders, first-line treatment is always non-pharmacological approach, because we have like SSRIs also, which are where we can find the first-line SSRIs, which we can prescribe, but still non-pharmacological methods like CBT or lightning therapy have more benefits. In more severe cases, when lightning therapy is not effective, we can add also CBT or maybe antidepressants. But even more severe cases, combining pharmacotherapy with lightning therapy is not effective, then we should suspect that we were not correct in our diagnosis. And about CBT, I think my colleague will talk about this much more. And also some essentials I want to tell you that are often underestimated but helps us a lot. This is just sleep hygiene, daily outdoor walks. By the way, this is not only for patients, this is for us also, for clinicians. Sleep hygiene is just fundamental, because especially maintaining a consistent sleep-wake cycle and reducing evening light exposure, which helps to save our circadian rhythms. Daily outdoor walks are beneficial even on cloudy days. Somehow our patients think that if there is no sun outside, this won't improve their symptoms. No, my darlings. They can walk even in cloudy days. Natural light intensity still exceeds indoor lighting and also promotes behavioral activation. Aerobic exercise has a clear antidepressant effect and improves energy, sleep, and sense of agency. Tone stimulation can be particularly helpful for patients who struggle with hypersomnia and difficulty waking up. These interventions are not alternatives to treatment. They are amplifiers of treatment. And there is, you should always spend some time to remind yourself about these essentials and discuss all this with your patients. What can we do for ourselves? So this is professional responsibility, not weakness. Seasonal depression, seasonal affective disorder, and winter fatigue affect not only our patients, as I told you, but as us also, clinicians as well. If we ignore this, it quietly influences how we think, how we feel, and work. I want to give you some micro interventions and advices, like daylight exposure before or after shifts. Even a short walk outside helps us brain reset. Natural light supports mood, sleep, and concentration. Light therapy at workstations. During long indoor days, light boxes can partially replace missing daylight and improve alertness. Protected breaks. Short, real breaks help reduce mental overload and decision fatigue. They are not just wasting time, they protect performance. This is your time. Like if you are studying or working in the clinic and you see that just you are on the top and you need some relax, some break, right? And you go anywhere outside for a walk, but you are still you're like who your group mate is texting you, what are you doing, how are you doing, are you preparing for the quizzes, exams, and something like that. Don't answer to such kind of text messages while you're having your own break. Okay, just do whatever you like. Listen to the music, watch the short movies, or watch some funny videos, anything you enjoy. But if you say that this is my break, this is my own time, just spend this time for yourself. Peer reflection. A few minutes of talking with a colleague helps normalize stress and reduces emotional isolation. Why I say this? Not only about seasonal affective disorders, guys. Doctors and healthcare professionals have high risk also of developing PTSD, because we see so many deaths, so many chronic patients, and we are on the first place while developing PTSD. And I always say to my colleagues while talking about PTSD also, just when you are having so much bad day, you saw so many heavy patients with heavy anamnesis and everything like that, or you are just having bad exam points or anything like that, and you go home where you are the only doctor in your family. No one, unfortunately, everyone tries to understand you, but still you are the only one who understands the heaviness of our profession. So just sharing with your colleagues always helps, trust me, because they can relate what you're right now going through. So if you have a bad day, just share with your colleague, with your medical friends from university, from another university. So just this is first of all just sharing, and the second is still saving your relationships and connections with people, and trying not to isolate. And naming emotional fatigue, recognizing and saying that I feel emotionally tired allows us to respond early before exhaustion turns into burnout. So being emotionally tired is okay, especially in medicine. And if you need any other help, or you just your symptoms just matched that I was talking about, you can seek help. For like me, I think Dr. Mariam will tell you about herself also, so you can contact us also. And in the end, I just want to thank you for your attention, and if you have any questions, I am ready to answer. Oh, thank you so much. Someone is clapping. Yeah.
Wow. Thank you, doctor. I can't help but feel that was incredibly informative. I mean, I myself felt a lot of stirring thoughts while listening.
Mm-hmm.
And yeah, so I can't help but, hope, like, on behalf of myself and all of our audience here, that we have ways to counter the effects of seasonal changes.
Mm-hmm.
So, which is why, in fact, we're joined by our psychologist, Dr. Mariam Shirdilili, who will talk to you about psychological approaches to managing seasonal depression. So this part of the session will focus more on coping tools, mindset, and practical strategies that people can apply in everyday life.
Mm-hmm.
So Dr. Mariam, the floor is yours.
Thank you so much. First of all, I want to say, Dr. Mariam, that was such an insightful, wonderful, moving presentation. Thank you so much. We really appreciate it. I'm sure students really appreciate it. So I'll introduce myself. I'm Mariam. I'm a psychologist. I work at New York University. I mostly work with international students. Some of you may already know me. I did also prepare a presentation. And please let me know if you can see it.
Yes, we can see it.
Okay, perfect. So I'll try to not go over everything that Dr. Mariam went over, and she was very, very thorough with her presentation, so I'll try to make it less redundant. So on the screen, you can see key psychological features. The only thing I would add would be the negative thinking patterns. So what happens during seasonal affective disorder and in general during the major depressive disorder is that people's minds shift. So they experience more negative thinking patterns. So everything is kind of going through a negative filter. It's more based on emotions rather than facts, right? When you're experiencing negative thinking patterns, if you ask the question of what evidence do I have that what I'm thinking right now is true, a lot of the times the answer would be, well, I don't think I have an actual evidence for this. I think I'm just seeing things through a negative filter, right? So one of the key signs, of course, everybody experiences negative thinking patterns, whether you have seasonal affective disorder or not, but usually during the depressive episodes, those negative thinking patterns are much, much more severe than usual, right? And why? Okay, so why does it happen? Dr. Mariam also explained this. I would add one thing that I think could be relevant because we just experienced New Year and it was a holiday jolly season. And a lot of the times, most people feel very happy during New Year's, but actually research shows that those people who are prone to depression and especially seasonal affective disorder, they feel less happy. And there are reasons for that. That is because you feel pressured to feel happy. You feel pressured to participate in this celebrations and to be with friends and to be with family, and this could be especially hard for international students actually, because they see their friends and family back home being very happy and jolly, and then you're stuck in a foreign country, which I'm sure Georgia is second home for most of you, but it's there's still this side of you which says, well, why am I not this happy, right? Why do I not want to go out and be with friends and celebrate? So a lot of the times what research shows is that New Year time and the holiday time could be especially hard for people who are prone to depression. So one thing I have to note, that if you felt this way, any of you, during the New Year season, you're not alone, and this is very, very common, and this has a reason, okay? And sometimes just not feeling alone also helps. So let's now talk about what can you do, like right now, without even going to a mental health professional, which I would really, really advise that if you do feel that you need external help, that's okay, and that's encouraged. But what can you do on your own? So light therapy, Dr. Mariam already talked about it, and that is first-line treatment, and that is very helpful. Beyond that, you should try to improve your sleep efficiency. So what is sleep efficiency? That is the ratio between the time spent asleep versus total time dedicated to sleep. So as we know, the sleep is disrupted during seasonal affective disorder. A lot of the times what happens is people sleep, there's increased sleep patterns actually, but sometimes there's a disrupted sleep, right? So in order to improve that, and in order to improve your circadian rhythm, you need to improve your sleep efficiency. What I mean by that is if you go to bed and you feel yourself turning around and not sleeping, scrolling on your phone and unable to relax, it's best to get out of the bed, relax somewhere else, read or watch TV on a low brightness, get tired, go back to the bed, and then fall asleep. So the point is, the time you spend in bed should be maximized for sleep. Don't use bed for studying, don't use bed for scrolling, don't use bed for anything else. And that way you can improve your sleep efficiency, and in turn, you will improve your sleep, right? You will improve your sleep quality, and you will have better deep sleep, which is the most important part of sleep, right? So daylight exposure, morning daylight exposure, Dr. Mariam already talked about that. Some people, research shows, that have blunted or delayed morning cortisol spike during seasonal affective disorder. So your goal is to spike that cortisol as early as possible. So the cortisol, which naturally decreases during the night, actually decreases on time, okay? And consistent wake-up times and consistent bed times as well. It's not as important to go to sleep early. A lot of the time when people say, well, I I do need to go to sleep at 9 p.m., which is very early and unrealistic. It is important. It is better to wake up as the sun comes up. But if you cannot do that, if it's unrealistic because you're a med student, you have exams next day, and you have to, go to sleep very late, it's at least what you can do is go to sleep at the same time every single day. So if it's realistically, right, if it's perfect, of course, earlier the better, but realistically, it would be best to go to sleep, suppose 1 a.m., right? That's a very realistic goal. And when you have this consistency in terms of your going to sleep and waking up, your brain also has predictability. And predictability is basically the best thing for your nervous system, because nothing is scary. You know exactly what's happening next, and therefore your nervous system is calmer. Okay, and predictability shouldn't be only just in your wake up times and going to sleep time, but also in your routine. The better routine you have, more predictable it feels, and the better you feel. Okay, so what can you do next? So behavioral activation. If you Google motivation cycle, a lot of the times, or behavioral cycle, a lot of the times what you see is it's first motivation, and then there's action, and there's reward, right? So everyone is waiting for motivation. We all say, I'm going to start walking outside when I feel motivated, and then it's going to be amazing. Or I'm going to start going to the gym when I feel motivated, and then I'll stick to it. And the reason I didn't stick to it before is because I wasn't motivated, right? And it's a very natural thing to think. But what happens actually is motivation comes after the action. Okay? You need to start doing things, and that's when you feel motivated to continue. And that's a lot of the times when I speak to some of the students who do go to the gym, what they say is, I didn't feel going to the gym, or I didn't feel going for a walk, but I remembered you saying, motivation comes after the activity. So I went, and then I actually realized that you were right. After you start doing something, that's when you feel motivated to continue. So, and if you think about it, the people who are experiencing depression, they don't feel motivated, which is one of the symptoms. They stay in bed because they don't feel motivated, and therefore they don't have a reward, and then the motivation is less. So it becomes a vicious cycle of not doing anything, and very understandably so. And therefore it's very, very important to start doing something, even if you say, well, I'll do it for 5 minutes, right? And see how it feels after 5 minutes. If you feel that after 5 minutes you cannot physically continue doing that, feel free to stop doing it. Okay, so it's just giving some activities a chance, so to say. Okay, so now let's talk about very, very important issue for especially, I would say, medical students and healthcare professionals, which is perfectionism, right? Perfectionism in your field is kind of very important in a lot of ways, because if you misdiagnose, if there's a medical error, this can cost a life, and we kind of bring it to our personal life as well, right? And there are actually positive perfectionism and maladaptive perfectionism, right? Positive perfectionism is when you have high standards, then you think, I have high standards and I think I'm doing okay. And the negative ones is I have high standards and you think you're not doing okay. In someone's opinion, you may be actually doing great, but the way you perceive yourself is very negative, right? So it's so important to reduce unrealistic productivity expectations. Okay, I'm not saying be lazy and don't do anything, but I'm more so saying give yourself a grace and have shorter, more realistic goals. When you have shorter, more realistic goals, you are more able to achieve them, and your confidence increases that you are able to achieve your goals. And therefore, if you increase your goals, you'll be more equipped to do them, because now your confidence is higher, right? So it's important to do shorter goals and be confident in yourself because you manage them, and then slowly increase your goals to things that you want to do in the future. Okay, and engage in activities that makes you feel you're more in control of your life. A lot of the times when I talk to the students, what they tell me is, I don't feel that I have control in anything. I don't feel in control of my life. What can I do? And then they name like big things of like, oh, I'm preparing for USMLE, and it's such a huge material. I don't know what to do. I feel out of control. I don't know if I'm gonna match. And there's so many very hard, big issues, and it doesn't fully depend on them, right? You can study, but then you can't quite be in charge of everything. You can't quite be in charge of what questions you're gonna get. So you need to start engaging also in activities that you have control over, right? You have control over, for instance, when you go to sleep. You have control over how you're gonna organize your room, how you're gonna organize your study space, right? So try to engage in those activities to feel that you have more control. Again, normalize your low energy and try to be kind to yourself. For instance, I should be doing more. You can be doing more, possibly sometimes. It would be great if you were be able to do more, but what happens then is you're worried that you're not doing more, you get more depressed, and you end up not doing anything, right? And you can't truly rest unless you don't feel guilty about it, right? When you're resting, and if at the back of your mind you say, I should be studying right now, I should be doing this, I should be doing that, if you have that type of mindset, the rest is never going to be relaxing, right? So that's why it's very important to normalize that it's okay sometimes to rest. It's okay that I have lower energy right now, okay? And make the rest of part of your productivity routine, okay? Don't take it as this, I'm taking time from studying. Take it as, I'm charging right now. When iPhone is on 1% and it's glitching and it's like barely working, and sometimes it's turning on and then it turns off completely, be like, I cannot operate on 1%, so I do need to rest. So make rest your productivity routine and normalizing yourself that it's not, don't feel guilty about it, okay, is what I'm trying to say. And okay, now I have kind of like a take-home tool, right? About, we can call it like a seasonal thought filter. And it helps with hopelessness, and it helps with winter, quote unquote, winter thinking. When you have a negative thought appear in your head, you can ask 3 questions. You can ask yourself, is thought seasonal or permanent? If it was a summertime, if I was at the beach, or if I was back home relaxing, drinking my favorite drink, would I still have this thought? Or is it because, the season, because it's all gloomy, because I feel this way during the seasons? Would I think this way if it's the summer? And what's more accurate version of this thought? That's one thing. And another thing I have to mention regarding the seasonal affective disorder is someone has to experience this 2 consecutive years in order to be a seasonal affective disorder, okay? If it's just 1 year, and it happens to have seasonal characteristics, it just appear to be like, I don't know, autumn or winter, you can just say it's a major depressive disorder with seasonal characteristics. But if it appears at the same time for at least 2 years during the winter or autumn, then that means that could be a seasonal affective disorder. So that means it's related to seasons, okay? So when to seek help? If you ask me, yesterday, right? You don't have to wait until you're in a crisis to ask for help, to reach to mental health professional, because what happens is that if you imagine a snowball on Everest, if you push it from the Everest, if you catch it very soon, it's a little snowball still. If you push it down long enough, it's going to become an avalanche, okay? And it's very, very hard to stop. If you let it run long enough, it's very hard to treat, okay? In terms of psychological damage it can do, in terms of your cognitive distortions, in terms of your negative thinking. So it's important to seek help early so that it's easier to treat, okay? So when to seek help, again, like yesterday, but one thing you can think of is 4D model. It's very easy to remember because all the 4 aspects start with D. First is it causes significant distress. Whatever you're experiencing, you're very distressed about it. Second one, it causes significant dysfunction. Okay, during your everyday life, you're unable to study, you're unable to do your everyday day-to-day tasks. Duration, okay, in terms of seasonal affective disorder, it has to be 2 consecutive years, and it has to be more than 2 weeks as you at least more than 2 weeks as you diagnose major depression, and it has to deviate from norm. What it means is that it has to be very different from how you usually feel. Okay, so 4Ds: distress, dysfunction, duration, and deviation from norm. So that's about it that I have for you. And I'm sure you're going to have a lot of questions additionally during the Q&A session. So I'll wait for those and then I'll answer whatever questions you have.
Wow, that was incredibly insightful. Thank you so much, doctors. Let's take a moment to appreciate our speaker, guys. Feel free to drop some appreciation emojis in the chat. For Dr. Mariam and Mariam, show some love, please. All right, so now this is where I get really excited. We have learned so much, and now it's time to put some of that knowledge into action. With our winter wellness minigame, this is going to be interactive, fun, and hopefully give you some practical tools to take away. Remember, this is completely judgment-free zone. You participate at whatever level feels comfortable for you. No pressure to share anything you're not ready to share. All right, everyone, let's switch things up for a moment. I would love for you to open the chat, get a little bit interactive. We're going to play a very quick game called Myth or Fact. I personally love this game. Like when I finish my my study, I love to get on some questions. So I'm gonna drop some question in the chat, and I want you guys to react to it. So firstly, question number 1. Seasonal depression only affects people in very cold countries. What do you guys think? Is it myth or fact? I think Dr. Abisunashvili mentioned that. All right. Oh my God. You guys are killing it. It's a myth. Actually, seasonal mood changes can affect people anywhere, even in places with mild winters. It's more about delight, routine, and individual sensitivity, not just temperature. Oh my God, you guys are doing so well. All right, so our next question. Feeling low in winter does not always mean something is wrong with you, right? Oh my God, you guys are killing it. Okay, that's right, it's a fact. Many people experience changes in mood or energy during winter. What matters is noticing patterns and knowing when to seek support. All right. So, question 3. Small lifestyle changes can help improve winter mood. Oh my God. I'm just a rookie here, guys. Oh my God, you guys are killing it. I should have asked more deep questions. That's right, guys. It's a fact. Things like light exposure, gentle movement, routine, and connection. It may seem small, but they can make a real difference over time. Thank you, guys. So, for our last question, all right, I hope this one actually helped. If someone has a seasonal depression, they should just push through it, right? Oh, I see Marzouk here. Oh, okay, I see you, Marzouk. All right, bravo. So for the last question, you guys mentioned it was a myth, and that was right. Mental health isn't about pushing through pain. It's about understanding your needs and responding with a care and support. Thank you guys so much for interacting. You're all are doing amazing. I can feel the energy and the connection in our virtual room here. So let's keep the momentum going with our most important game yet. So, creating your own personal wellness plan. This isn't about a big, overwhelming changes. It's about small, doable steps that can make a real difference during these winter months. Remember, be kind to yourself as you think about this. Choose these things that feels manageable, not things you think you should do. So here, what I want you to do in the chat, write 3 simple things you can do in this winter to take care of yourself. 1 for each category. So I'm gonna share something. Here you go. We got body, mind, and social. Guys, take a look about it and just write. Keep it short and simple. Just like, for the body, you can type walk, mind, gratitude, social, maybe text some friends. All right, I'm gonna guys give you 2 to 3 minutes to respond, and I'm gonna get back. Alrighty, I'm seeing a lot of walks in here. All of you are just love walking, guys. I think that's cool. I love walking myself. I love going to the gym as well. Yeah, and some guys said PlayStation. Man, I do that a lot. Yeah, and football as well. Oh my god. Oh, Marzu has the best answer so far. Oh my god, Marzu, you have the best one. So that was so good, guys. Beautiful. I can see so many positive vibes here. Thank you all for being so open and engaged. You have created such a warm and supportive energy together. So that was absolutely wonderful, everyone. I hope you all have some new ideas and tools to take with you. So now we're moving into our Q&A session. This is your chance to ask our speakers anything that on your mind about seasonal depression, the topic they covered, or anything that came up during our activities. You can ask question live by raising your hand, or if you're more comfortable, you can type your question in the chat and I will read it out for you if you want to. No pressure either way, whatever feels right for you, just do it. So our speakers are here for you, so let's open up for our questions.
I think we'll have a moment of awkward silence only because people will be typing, or they'll be deciding whether they want to go for the mic. So we'll go ahead and let you guys take your moment to go ahead and think of your questions, how you want to phrase them, how you want to say them. So yeah.
And also, the question doesn't have to be necessarily about the disorder itself. It can be like a personal thing that you're going through, or if you need, or if you know a friend who's been affected in terms of their mental health and, you don't know how to help, or anything of that sort that's related to depression, okay?
Yep, that's great. I have a question, Professor. What do you love, the winter session or the summer?
Sorry?
What do you prefer, the winter or the summer? Yeah.
I don't have preferences.
Yeah. Okay.
But I feel that treatment for seasonal affective disorder is more straightforward in a way, because it is associated with seasons. So you know that there's some circadian rhythm disruption. There's probably things happening with blunted cortisol spikes. So there are things that are more straightforward, but if it's in the summer, then it could be a bit different. So there's a question. Do you want me to read it out loud, or do you want to read it? Because you're a great narrator, by the way. So
yeah, feel free to go ahead.
Yeah, go ahead.
Oh, you want me to read it out?
Yeah, okay, I'll read it. Okay, so someone is asking, what do you think about online sessions? Because I don't feel it works for me. And explaining what I feel in my mother language is way better, but unfortunately we're abroad. That's a very good question, and there are a lot of people who feel so. From personal experience, I could tell you that I've had similar success with both online and offline sessions. But also there's a cheat code, because sometimes they come in person at the beginning and then it switches online after the trust and rapport is developed. So I could be a bit biased, but I if you find it hard to connect through screen, I can understand that, but I can't say that they're ineffective. And it's not just my experience as well. We do have another psychologist at the university, and she mostly had good experiences as well. So maybe it could be just, maybe you couldn't develop rapport with the current psychologist. That could be the reason. But I do also agree that speaking in mother language is a bit different during therapy. Some students say that it's better for me because I could never say these words in my own language, because when you say in your mother tongue, it has more meaning somehow, right? So sometimes they say, like, for instance, saying I love you in your mother tongue sounds very different than when you say I love you in English. It kind of sounds like a random casual thing, but in your mother tongue, it sounds like very passionate, right? So it's same regarding describing your feelings. So yeah, the language thing I understand. Online, it's the yes or no answer. What can help with the disassociating and depersonalization that depression brings forth? So the best thing that you can do is actually mindfulness. That's very fitting, right? So grounding yourself in the present moment and trying to make sure that your brain knows you're here and you're feeling what you're feeling, and you're hearing and smelling, and everything is now. Right, so that's one of the main things you can do in the moment. But also there's a thing as well, right? What causes disassociation, depersonalization, right? It could be that it has nothing to do. I mean, yeah, it's related to depression, but it could be many arrays of things that causes that. So it's also important to find the cause of that as well. What do you think if we feel we are not okay? Sorry.
Sorry, Dr. Miriam. I just wanted to let you know we did have raised hands from Zaina and Nisreen. So if they still want to go ahead and speak, just wanted to give them the chance.
Of course.
Zaina raised her hand first, so go ahead.
Hello everyone.
Hi.
Good evening. How are you, doctor?
Thank you. I'm well. Don't call me doctor though.
Okay, how are you, Maria?
Thank you. I'm well.
Okay, I had a very stupid question, probably. I don't know. It's like, how can you, like, within a minute or 5 minutes, how can you snap out of a sad mood or a sad feeling? Is there an instant, like a recipe or something to snap out of a sad mood?
Is it a sad mood or is it an anxious mood?
It's more of a, I can say it's anxious, which follows with sadness or upset.
Mm-hmm.
Yeah.
Well, if it's an anxious mood, and if you feel that you feel it in your body in terms of increased heart rate, then there's the breathing techniques, right? You shorter inhales and longer exhales. That's like very standard thing to do. Another thing is to, first of all, you think first and then you feel. A lot of the times people get into the bad mood and they have bad thoughts, and sometimes it's like, if it's a chicken or an egg, what comes first? But you think first. So you need to ask yourself, okay, I have all this thoughts going on in my head, and those thoughts most probably are not articulated in a very articulate way, right? It's jumbled up. You don't think in full sentences. It's all a mess. So what you can do is grab your phone, notes app, write down what you feel. And when you have to write it down, you have to make sense yourself. Okay, so it's not a jumbled thought anymore. It's a coherent sentence. And then firstly, what that does is that makes it clear what makes you sad. And then you write it down, then you have to challenge those thoughts, right? And you have to see, okay, I'm, for instance, upset that my friends don't like me. And then you have to ask yourself, okay, what evidence do I have that they don't like me? And then if the answer is, well, they didn't pick up the phone when I called. So is that an evidence they don't like me? Well, that could be because they were busy, they had exams. So it's kind of like the line of questioning to see what makes you sad. One, make clear what makes you sad, and two, challenge those thoughts and see if there's if there is a rational basis to that sadness, right? And even if there is a rational basis, then you have to take a bigger perspective, right? You have to zoom out and be like, okay, I'm 5 years ahead, I'm a doctor, or I'm in residency, I'm back home, I'm with my friends and family. How much does this matter then? Is this really as catastrophic as it is now? Okay, does that answer your question?
Yeah, it was really thorough. Thank you, doctor.
Okay.
Thank you, Mariam. Thank you so much.
First. Okay, there are more hands, but I don't know who goes first, but I'm listening.
Yeah. So I just wanted to ask Nisreen, do you still have your question?
No,
Because
I think my question is very similar to what Zena asked, so it was along the same lines. So thank you so much, Mariam. Very
Okay.
insightful.
So our
Next is
next
Zara.
question is from Zara. Yes.
Yeah. Hi. I wanted to ask you this, that do people with underlying mental health conditions, that means if someone already has something, they experience reduced engagement during this season, and if they do, what can actually help them to get back on track with their treatment?
I think if you already have a mental health issues beforehand, even before the seasons, right? I think what's important, as I've mentioned in the presentation, is not to wait for the season to come. If you know that, okay, this is a pattern, it's been like 2 or 3 years where when seasons change, I experienced this, you have to take, prevention is the best treatment, right? Even in medicine, prevention is the best treatment. So you have to, if you struggle with other mental health disorders as well, I think it's important to work with a specialist and start developing tools so that when seasons do change, you're already prepared to, and you already have tools to deal with it successfully. Okay, but the simplest things I can say is, as I've mentioned with the seasons, is, the sleep hygiene, sleep efficiency, right? Like going to bed when you actually want to sleep, morning sunlight exposure, having a routine, predictability, and kind of giving yourself grace. And it sounds very easy and silly sometimes to students when I tell them, but then if you ask yourself of like, how much times do I actually forgive myself when I make mistakes? And if you notice your reactions to your mistakes, in my experience, people have very severe reactions to their mistakes, right? So giving yourself grace would be like kind of very, very important in this process. Let me know if that answers your question.
Thanks. That very well answers my question.
Thank you. Thank you for the question.
All right. So we also have questions from our registration Google form. So I'll go ahead and read them out.
Yes. So before we get to that, Jenna had another question in the chat. Can I answer that and then we go to that?
Oh yeah, absolutely. Go ahead.
Yeah. So she's asking, what do we do if we feel we're not okay, but we don't know what's going on? There are things that are not going right, but you don't have a proof that something is wrong with you. You don't need to have a proof. Right? You don't need to, a lot of the times people don't ask for help because they think that they need to be feeling very, very, very down in order to ask for help, to friends, to family. And they feel that, if I don't know what's going on, how do I explain it to someone else, right? But similar, as I mentioned before, when you feel sad, how to snap out of it, like write it down. Similar to that, when you explain it to your friend, in the conversation and in the process, you make better sense of your own feelings, because you have to explain it to other person, and if you don't understand what's going on, it's hard to explain. So if you have a friend that you trust, just sit down and be like, I don't know what's going on, can you please help me to find this out? And together they can, and if you don't know anything, you can be like, okay, let's go through different aspects of my life. Let's go through my career. Let's go through my family relationship. Let's go through my friendships. Let's go through my daily habits. And one by one, you can kind of discuss and dissect which area and which aspect is probably not where you want it to be. And slowly, by talking it out, at least you'll find out what's going on. And then after that, if you feel that, okay, am I equipped to take care of this on my own, or do I need a help of a friend, or do I need the help of a professional? That would be my answer.
I can't help but agree with your answer, Doctor. Sorry. I'm
Mario,
Mary.
that's
Yes,
okay.
I'm sorry. We also have one more question in the chat from Rahma Mansoor. I thought it was a really good question. So before we go to the ones from the Google form, probably leave that next one is from her.
I think I answered that with the disassociation and depersonalization, so we can move on to yeah.
Okay, sorry, my mistake.
Yeah.
All right,
It's
so from the Google form responses, our first question, most of these, I think all of them are anonymous. So with overflowing thoughts about career, future, and loneliness in a foreign country, what is something one personally can do who is going through seasonal depression other than talking about this with family? Something like motivation, which helps in day-to-day activities or studying or etc.
Yeah, and I think it may be a bit redundant, but going back to what I explained, like if it's like really related to seasons, then it's like the sleep hygiene, the daylight exposure, if they have means like light exposure therapy as well. But in general, I think reframing your thoughts, and this may be very redundant because I say it so many times, but reframing your thoughts to the ones that are not through negative filter is the best. This is basically what CBT is based on, which is the cognitive behavioral therapy, which is taking your distorted thoughts that are very negative and negatively biased and putting them in a frame which is productive and more realistic and more based in facts, right? So just, and the first step in self-care and improving your mental health is also noticing as well. A lot of the times in my personal experience working with students, they do say, well, I have all this negative thoughts and this is going through my head, and then when I ask them, like, do you notice it in the moment, or rather than at the end of the day or after it's been happening for an hour, then you see that, oh, I've been having so many distorted thoughts. And usually they say, when it starts, I don't notice it. I only notice after a certain amount of time, because then I feel it in my body, right? Then you feel heavy and then you feel sad, right? So it's important that the moment this negatively filtered thought appears, for instance, oh my God, my career is doomed because my GPA isn't as high as I want it to be, right? Which is a very common thought, I would say. Then you should ask yourself, okay, is my career really doomed? Probably not. There's many things you can do beyond GPA to stand out, right? So just catching it very, very early on until you feel it in your body. So noticing, I would add, is like very, very important in this. So there's another question. I hope I answered the question to the person who was asking. With overflow, that's the same question.
Sorry, I decided that it might be a good idea to, in case you ever need to see the question again, I would put it in the chat. So yeah, I'm also typing. Yes. So now I'm typing the next question in the chat for you, so you can read it as well. How can we tell the difference? Oh, sorry. Go ahead.
Yeah, go ahead.
Okay. How can we tell the difference between normal winter fatigue and clinical SAD?
Okay, so that's Nishri has a question, maybe.
I'm sorry to interrupt you. You can go ahead and answer that question, but before that, I will just put in the chat a link of a form, so all of those who have attended can fill out this form, so we know your attendance and we know if you have any feedbacks and everything. I'm so sorry to interrupt. Mariam, you can go ahead and answer the question.
That's okay. So between normal winter fatigue and clinical SAD, that's a very good question. So in order to be diagnosed with seasonal affective disorder, you have to have major depressive disorder that occurs 2 years consecutively that is associated with season change. Okay, so it's not just 1 year. You have, like, if you have a depression that happened to be in winter 1 year, you just say it's a major depressive disorder with seasonal patterns, but you don't necessarily say it's seasonal affective disorder. So seasonal affective disorder has to be 2 years in a row, so to say. And in general, how do I know that it's just a normal, quote unquote? I don't like the word normal just as much, but what is like, quote unquote, normal, and what is like disorder, right? And I go back to what I had on the slide, which is 4D. It has to cause significant distress. It has to be dysfunctional, right? It has to have certain duration, and it has to deviate from norm, right? So suppose you usually are feeling a certain way your whole life, and all of a sudden you feel a different way that deviates from your norm, right? So that's what it means. But everybody's norm is different, right? So it's important not to compare yourself to other people. And again, dysfunction, deviation from norm, duration, and distress. Those 4 things, if you feel that how you feel checks out all those 4 things, then it doesn't matter if it's, SAD or just major depressive disorder. That means that something possibly is going on. So it's important to seek help.
All right. Thank you, Miriam. So our next question, I'll put it in the chat here, is does sexual desires increase during winter?
I don't think that it's necessarily, that I know of, related. I think maybe Dr. Miriam would be more equipped to answer this question, but from my personal experience and from my knowledge, I think if it were to increase, it would be more so biological reasons, but I would doubt so, actually. Yeah, I would doubt it, because usually if winter is associated with a lot of the mood shifts that is negative, then I would assume that sexual desires would decrease, because mood shifts does affect sexual desire negatively. So that's the best I can answer without telling you something that I don't know.
All right. On our next question, I didn't have enough time to type it.
Okay.
I will get there in a moment, but for now, based on what I'm experiencing, poor focus, inconsistency despite motivation, overthinking, and burnout as a medical student, what is the single most important change or tool I should implement right now to regain control and function better academically? So essentially asking for the single most important change or tool they can use.
I would say it's routine. If I had to choose, and I think routine encompasses so many different things as well, including the sleep wake up cycle, I think the routine would be my number one thing, and especially with the focus as well. And routine is one of the first things that you could also try to help implement someone with ADHD as well, because it really helps with the focus. So that is because focus on intention, because it does give your brain kind of a break to think what's next. Because if you sit down, there was a study conducted where people at work, at the end of the day, they wrote down what they have to do tomorrow, and the next day, first of all, next day they were more productive, but that's not the point. When they did go home, they felt more relaxed, and that is the reason. The reason for that is because they didn't have to think about all this undone things that they have to do, because they knew that was already taken care of. So when you wake up every day and you know that, Mondays I do this, Tuesdays I do this, and you don't have to think what comes next, one, you feel more productive, two, you feel more focused, and your brain is less cluttered, which in turn increases your attention. And your rest doesn't make you feel guilty, because you know that is part of your routine, which overall is a productive routine. So then that rest doesn't feel like I have to be doing something. Okay, someone has a question?
Yeah, and also this will be the last question. So go ahead, Ahmed.
Okay, so might be some out of context question, but for myself, I found myself spending too much time gaming. Like even when I know it affects my studies, sleep, or mood, I've tried to cut it down, but I keep coming back. Like it became like a part of my daily routine.
Mm-hmm.
It's like gaming is not like about wasting time. It's more of a competitive behavior I have. Like I do suffer from I play competition or a competitive game.
Hmm.
So yeah, I don't like wasting time on other games, only the competitive. So I think I have this problem, the competition itself.
Hmm.
You know?
That's a very complex thing. Would you say that you have a specific times where you play? Do you feel that that causes dysfunction in your life? As in, like, you want to play all day and sometimes you play instead of studying? Or do you have, like, in the evening, there's 2 hours of playing, which every day you play?
No, I choose playing over anything.
Okay, so
Yeah.
and I think that's where the routine could help as well, and that's where like the scheduled relaxed time could be very helpful, because for instance, if you schedule that every day from 9 to, I don't know, 12, I can play guilt free because I know that rest of the day I'll do everything that I need to do. One, you may enjoy playing even more actually, and two, you can have kind of playing games, you can have it as like an incentive where if I get everything done, this is my like, big reward at the end of the day, right? So that makes it rest of the day kind of like I have something to look forward to, but before I do that, I can, you know, I have to study. And you can even kind of like punish, I don't like punishments, but punish quote unquote yourself with like, if I don't get this done, then I don't get to play at the end of the day, right? Or I get to do like less rewarding activity for me specifically, which is like maybe watching TV shows, which is still relaxing and rewarding, but not as rewarding as playing games, right? So you can kind of use it to your advantage.
I understand. So reward and punish myself.
Yeah.
But the point is, I cannot help but think about it the whole day. You know, like while studying, I think about how I gonna win.
More so, think about it this way: when you think of playing, think of how enjoyable that playing session will be when you sit down knowing you've been productive.
Oh.
And that's a very rewarding thought of like, I'll have so much done and it's end of the day, I've studied, I've exercised, I've done everything, and it's from 9 to 12, I'm on top of the world doing my favorite thing while being the best student ever. And I think that playing game will be much more enjoyable for you, and I think you can use that information to your advantage.
Yeah, absolutely. Thank you so much.
Of course. I think there was like one more question.
So do we have
Unfortunately,
anything?
we're unfortunately running low on time, so we're going
That's
to.
okay.
Yeah, we don't have time for any more questions. Apologies to everyone who has left questions or responses in the chat or in the Google form. But now we'll get moving forward with Ahmed. Are you ready to move
The
forward? Yeah.
resource sharing,
Mhm.
right? Okay.
Hi guys, it's just a reminder for you guys to fill the form that we had put in the chat earlier. It's an attendance form that would make us, confirm that you guys did attend, and we can distribute the certificates more easier. So go ahead and feel free to fill the forms that we have shared earlier.
Oh, right. So, Marzu, do you want to take over or should I?
All right. So before we close, we want to make sure we leave you with some useful resources you can come back to later. This includes, SAD self checklist, coping strategies and information about helpful apps and support contacts. These will all be sent out in after the session, so there's no pressure to write anything down right now. If anything from today resonates with you, so please feel free to give these resources a look. As we wrap up, I want to thank all of you for your time here today. Showing up for conversations like this is an important step in caring for mental health. We also have a little word from our from Madiha, who has a few words she wants to share. So Madiha, go ahead.
Hello everyone. I just wanted to thank all of you for being here. I'm so happy and I'm so honored to see you all come here and join us in our very first webinar and hopefully many more to come. So I hope you have taken some things that as a share home message, and I hope we see you again. So thank you so much for spending your weekend and for spending so much of time with us, and I hope you enjoyed it. Thank you so much.
All right then.
Thank you, Madiha.
So, and thank you, Madiha, and thank you to Mariam for being here with us. We hope you leave today feeling a little more informed, a little more grounded, and with a few tools you can use moving forward with each passing season. Thank you again to all of you, and take care.
Thank you. Have a good night. Bye-bye.
Thank
too,
you so much.
Professor.
Thank you so much, Mariam. Good night.